This podcast does not provide medical advice. The information included but not limited to any videos, texts, graphics, image materials, or any programs or consultations contained within this podcast are for information purposes only. The podcast does not constitute providing medical advice or professional services. It does not constitute a patient-physician relationship. If you have medical concerns, please seek out your private physician, or if you feel you have a medical emergency, please contact 911. Welcome to Cars and Coaching, the podcast where we combine our love for cars, medicine, and self-development to get you to the life that you deserve. Welcome to our podcast, Cars and Coaching. My guest today is Dr. Minesh Morker. He is an attending physician at Northwestern Hospital, and today we'll be talking a lot about sleep. Minesh, I'll let you introduce yourself a little bit. Tell us a little bit about your background, how you got into medicine and sleep, etc.
All right, thanks for having me here. So I basically started my journey in medicine from undergrad at Benedictine University. I went to medical school at Medical College of Wisconsin in Milwaukee. And then I did my neurology residency at downtown Northwestern. I also did my sleep fellowship there, and then another fellowship in neurophysiology at Rush University. Now I work at Kishwaukee Hospital. I'm the stroke and sleep medical director there, and I have a full practice. I do both inpatient and outpatient work there.
Oh, fantastic. And we know each other because I used to work for the same facility. And it's interesting. I knew you had the fellowship in sleep. I didn't know you were that smart to have the extra fellowship, so I never did my homework from that perspective. But, you know, part of the reason why I wanted you on here is obviously I've known you for years and I respect your medical knowledge, but sleep is so important. And I think it's one of the things that a lot of people take for granted, especially our young population, whether that's those that are studying for school or whether it's those that spend a lot of time partying.
Yeah.
And I think when you're younger, you get that little bit of leeway and you really don't realize how important sleep actually is. Yeah. So from your perspective, what are some of the things that if we don't get proper sleep actually can be a negative effect?
Yeah, I mean, again, lots and lots of data and studies have looked at sleep and how integral it is in all aspects of your bodily function, from both physical and mental standpoint, right? It's involved in essentially everything in your bodily function, right? From your immune system to your cognitive functioning, your heart health, respiratory system, recovery of muscle and joint injuries and things like that. And so people, like you said, take sleep for granted sometimes and don't realize how much of a detriment you can have when you're not getting adequate amount of sleep.
Yeah, no, it is interesting. And I was reading something. Well, Matthew Walker obviously put out a book on why we sleep for the lay person, but he was talking about how if you're at 20 hours or so, you are so cognitively impaired that it actually is equal to being intoxicated. And I think, if I'm not mistaken, they actually ran a study where they had people that were legally intoxicated and those that were sleep deprived, and the intoxicated people did better on things than actually those that are sleep deprived, which is really interesting because obviously as physicians, we took call, we still do take call, and I know I work with a lot of trauma surgeons in my consulting practice, and some of those shifts are 24, 36 hours.
Yeah.
And when you're able to do that time, it's fantastic. But I don't know if I trust them medically and from a knowledge perspective, but this is something that actually deprives them of their cognitive ability to be able to make decisions, etc.
Yeah, no, I mean, they did simple studies as, hey, you're just going to look at the screen. When a red dot comes up, you push this button. And they saw that when you're sleep deprived, you make multiple mistakes, and like you said, it's comparative to someone who's intoxicated, you know. And so I remember in residency, we used to do 36 hours every day, you know, not every day, but every time we were on call. And at that time, it's not as simple as just clicking a button, right? You're making decisions which impacts someone's lives, you know? And so that's why I think, again, they have learned this, and now newer residents in medicine have limitations where they can only work, I think, like 16-hour shifts at a time. And I think they've learned how much sleep plays a role in their cognitive functioning and decision making. And so I think they're learning from that and making changes. But once you're out in the regular world, there's no restrictions, unfortunately.
And we always, what's the saying, right? We'll sacrifice health for wealth, and then we'll pay all our wealth back to get back our health, right?
Exactly.
So it's the same deal that we end up doing. You know, that's actually interesting. And one of the things that I do is, obviously, I'm a consultant. I do a lot with disruptive physicians, and I always find it amusing that most of the disruptive behavior is at 3 in the morning when they're on call.
Yeah.
So from the emotional perspective, from the amygdala, the midbrain, to the prefrontal cortex.
Yeah.
So when you're intoxicated, when you're sleep deprived, if I understand this correctly, there's actually a disconnect, right?
Yep.
Between the emotional and the prefrontal cortex.
Exactly.
How does that work?
So again, when you're functioning and how we respond to stimulus is all dependent on those connections. And when you're sleep deprived, like you said, that connection of reasonable thinking, your critical thinking, and the emotional component all get disconnected, right? And so now when you get an emotional response, you're gonna respond without saying, hey, this filter needs to be in place because I'm in a professional setting, right? But when that connect's not there, you're gonna respond with the emotion you're feeling right there, which is in 3 in the morning, you're gonna be like, hey, why am I being woken up for something as small as this, right? And you're more likely to be agitated and respond in a unprofessional manner, which can lead to obviously other issues down the line.
Oh yeah, no, and that's what I try to explain to not only the administration, but not to say that disruptive behavior or being short is acceptable, but there's a reason, right?
Yeah, exactly.
So exactly what we were saying earlier, when someone's intoxicated, their inhibition is down.
Exactly.
And they don't use that prefrontal cortex or that executive function to run it by. So they will tell the boss what they truly think of them, or they will tell the nurse where to get off, and then they get into trouble. So they end up doing stuff like that. From a perspective of students, you know my son well. The audience knows my son. He's a med student, and I think now he's getting a little smarter where he gets some sleep, right? But how important is sleep for the consolidation of memory?
It's very important, right? And so basically, sleep is the time when your brain is really sorting out your day, right? It will look at different memories from like, hey, when I drove from work to home, it says that's useless. We're gonna get rid of it, right? A conversation that you had, right, with a colleague or a patient and says, hey, this might be somewhat important. We're gonna put that in the short-term memory, right? And then something that you're like, hey, I really need to remember this. So you repeat and repeat and repeat, and the brain's gonna say, hey, this is very important. We're going to put this in the long term, right? This is very simplified. Then certain things which has emotions attached to it, right? When the amygdala and the hippocampus connect, that's going to leave a more lasting memory. And that, again, gets stored in the longer, right? So if you're driving from work to home, when you get to work, you're not going to remember what happened. Now, when you're driving from work to home and suddenly you were almost in a car accident, right? That has an emotion attached to it, and that's gonna leave a lasting memory. But then when you're not getting enough sleep, right? So when you're not getting enough sleep, you're not getting slow wave sleep, REM sleep. Those are the key periods when you're gonna consolidate your memory. And typically, as you go to sleep, we sleep in cycles, right? So we typically sleep in an hour and a half cycles. And during that first cycle, we're going to get a very tiny amount of REM sleep. The second cycle, a little bit longer. Third cycle, a little bit longer. And fourth and fifth cycle are primarily REM sleep. And so now when you're not getting into the fourth or fifth cycle, you're not giving your brain enough chance to consolidate that sleep. And so then when you wake up and you start your day, everything that was there from before is essentially trashed and it's gone. And so now you're not going to have really memory of that because the brain was never able to sort it out. All right. And so again, that's a very simplified model, but basically there's a lot of integral connections that are made, and that's where, again, sleep plays a big role in trying to maintain those kinds of memories that you develop throughout the day.
Yeah, no. So there's actually non-REM sleep and REM sleep, correct?
Yeah, yeah.
So it's REM sleep that does a lot of the consolidation.
Yeah, so there's something called slow wave sleep, which is stage 3 of sleep, and that is also part of it, but the REM sleep is also a big integral component.
In terms of how long we should sleep, you in your practice, do you find it's obviously individualized, right? So
yeah,
not everybody needs
exactly.
the same amount of sleep.
Yeah.
But what's that range that most people need for their sleep in order to be considered healthy?
Yeah, so that range is actually pretty wide. It's from 6 to 9 hours, all right? When we look at it, we say the amount of sleep that a person needs that's healthy for them, it's a bell-shaped distribution. All right, and so we say one standard deviation is about 7 to 8 hours. And that's where, again, when you read anything on any articles, any books, they're going to say 7 to 8 hours because it's about one standard deviation. But 2 standard deviation is about 6 to 9 hours. And then the rest is that very tiny portion that's on the very low and very high end. All right, but a good way to gauge what's healthy for you is the amount of sleep you're getting if the next day or every day when you're awake, if you're able to function without caffeine and you're able to function perfectly throughout the day without getting sleepy, dozing off, that's probably good enough for you, right? But most people don't realize that they're not getting enough sleep because we drink so much coffee. We drink soda, energy drinks, right? And that counteracts some of that sleepiness, so you don't feel like, hey, I'm sleep deprived.
So in terms of you've touched on caffeine, and I know huge addiction, and
Yeah.
Starbucks is making.
Yeah.
My son should have Starbucks license plates, but so how do we get sleepy? I know there's a circadian rhythm, a suprachiasmatic nucleus, and certain things create sleep. So how do we go through the day, and all of a sudden we know that at nighttime we're tired? What's the
So there's a lot of neurotransmitters that are involved in that, and like you pointed out, circadian rhythm is a big component, right? So when as the day goes on, there's different cues that tells our brain, hey, this is wakefulness, right? Bright light when you're out in the sun. There's circadian cues from your gut, your heart, right? And that tells you, hey, this is the time to eat. This is the time to go to the bathroom and things like that, right? So there's circadian cues to that as well. And similarly, at nighttime, there's other circadian cues, right? So melatonin, right, is a big kind of trigger. It's not the melatonin when it comes on doesn't say, hey, this is when you're supposed to sleep, but it starts telling your body, hey, now is the time that we need to start winding down and we need to go to sleep, all right? And so there's an intrinsic clock that tells you. That's why when we go to daylight saving times, you start having a little bit of problem,
and
right?
we're actually filming this on the day that's going to happen.
Exactly.
So.
And so that's where, again, your clock isn't ready to shift, right? Similarly, when you fly to a different time zone, right? That's because now you're fighting against your internal clock to say, hey, this is when you're supposed to sleep. But if you flew multiple time zones, like, right, if you flew to Europe, when you're supposed to be sleeping, it's the middle of the day, right? And so that's where you get that jet lag component, all right? Your body is able to adjust to it, but it takes time, all right? And so if you don't do the healthy things in those time period, your body is never able to adjust for it.
What is your, so for caffeine, half-life, 6 hours, I believe, something like that?
Yeah, I don't know the exact number on that, I'm sorry. Yeah, but I think it's like 6 to 8 hours, yeah.
so important, obviously, to stop the caffeine earlier in the day. From a when patients come to you with insomnia,
Yeah.
what's a good sleep hygiene routine
Yeah.
for someone to be able to go ahead and get better sleep?
Yeah. With vast majority of people, it's their sleep habits. All right. That's what causes insomnia. All right. Other people, it's a lot of other medical issues, right? Pain issues. Hey, I can't ever get comfortable because I have back pain, knee pain, whatever. Some people, it's anxiety issues. Hey, I can't turn off my brain, right? And so those things you need to address with a medical professional and treat those. But vast majority of patients, it's purely their sleep hygiene, right? What time do you go to bed, right? What time are you waking up, right? So consistency is very important, right? Your brain likes to set that circadian rhythm and say, hey, once you consistently do something, your brain will say, hey, that's our circadian rhythm, right? This is when we're supposed to sleep. This is when we're supposed to wake up, right? Caffeine is another big component, right? Patients will drink caffeine and alcohol at all times of the day, and that can really disrupt your sleep, right? While alcohol can make you sleepy, it can really fragment your sleep. And so most people who drink alcohol will realize, hey, I wake up multiple times in the middle of the night if you've had multiple drinks, right? So we typically say no alcohol for a couple of hours before bed. Similarly, caffeine is activating, and it will prevent you from falling asleep. And so patients will drink espresso or something after their dinner and realize that, hey, when I go to bed, I can't fall asleep, right? The other big things are screens nowadays, right? So everyone has an iPhone or a smartphone, tablets, and computers, and they're going into bed with it, right? And when you're doing that, unless you've set special settings, which now these manufacturers are becoming smart and realizing that, hey, we should try to automatically get rid of something called blue light, right? Blue light is very activating, but when you don't have those settings on, you're getting that blue light which activates you and it prevents you from sleeping, right? Because again, like we talked about earlier, melatonin helps with that to set that tone. But when you get that blue light, it prevents that melatonin from activating, because like you said about the suprachiasmatic nucleus, that's one of the things that suppresses that is that blue light. And so again, getting rid of those screens, right? Typically we say at least an hour, ideally 2 hours before you're gonna be going to sleep, right? Developing good habits of like winding down period, right? Everyone has a hectic day, and so give yourself some time to kind of relax, decompress. This will make it easier to fall asleep. Exercise, very important to get regular exercise, right? What we say is not only do you get the health benefits from exercise, but more active you are and more you exercise, it essentially tires you out, right? And lets you fall asleep easier and stay asleep. All right. And so those are some of the big things that I really target when my patients come in with insomnia, is to say, hey, consistency is the key thing, right? Get TVs out of the bedroom, get the screens away, and consistent sleep and wake time are the big things I target.
In terms of obviously we talked about light, so the room should be obviously as dark as possible. How about temperature? I know people always talk about temperature as it relates to sleep. Should it be colder? Should it not be colder? And I know the circadian rhythm controls the body's temperature, so it kind of has a sway throughout the day.
Yeah, definitely. So one of the key things that happens before you fall asleep is your core body temperature goes down. All right. And so if you're in a cooler environment, you're helping promote sleep. What we say is making it too hot is going to make it harder. But again, it should be a comfortable temperature for you, right? Don't set the temperature to like 50 and then you're going to be freezing and you're going to be uncomfortable, because then you're not going to be able to fall asleep, all right? So again, with the temperature, what we say is comfortable temperature for you, but a little bit on the cooler side is going to help promote sleep.
Yeah, good. You'll in the literature or in different things, people will talk about owls and larks, right? And they'll talk about that, people don't function well in the morning and other people do. And I think the theory behind that is through the development of mankind, somebody would have to stay awake to make sure the tribe wouldn't get wiped out. So they kind of had that genetic predisposition while others slept. Your thoughts on that? Exists?
Oh, definitely, right? So we know everyone's circadian clock is different, right? So there are some patients' circadian clock that promotes sleep earlier, and some patients it promotes sleep later, right? And so definitely it's an intrinsic clock. We see hormonal changes as you fall asleep and things like that, and we see their hormonal shifts and peaks and valleys are completely shifted, right? Larks is going to be earlier, owls are going to be much later, right? And so that's where some patients will come in with insomnia saying that, hey, I can't fall asleep. I try to go to sleep at 9 o'clock, and no matter what I do, I can't fall asleep till 12 because that's their clock, right? Their clock is saying we should be going to sleep at 12. And so typically these patients who are night owls will come in saying, I can't fall asleep. And then when I wake up in the morning, because now they're trying to go to sleep at 9 o'clock and waking up at 5 or 6 o'clock, they're like, I feel groggy. I can't function because I'm so tired, because they're waking up in the middle of their sleep, right? Because their circadian clock says, hey, we should be sleeping from 12 to 8 o'clock, right? And we see that the circadian clock actually shifts as we get older, right? So younger patients, teenagers, tend to be more towards night owls, all right, where their circadian clock is telling them to go to sleep later and wake up later, all right? And that's where we see that the school systems are doing a disservice to these younger kids by starting school so early, all right? And they actually tested this in the Navy because they could easily control that, right? Whereas the general population, we can't control. There's too much politics. But in the Navy, they essentially just had these young kids start school an hour later. And the test scores significantly increased because now they're actually waking up when their body is telling them to wake up. And so then when they're starting school, they're functioning like normal functioning. Whereas these earlier school times, you're waking up in the middle of your sleep. And so you're not functioning as well. And so you start off with night owls, and as you get older, you start moving forward and forward and forward. And so once you get into the 70s, 80s, these patients want to go to sleep at 7, 8 o'clock, right? Because that clock shifts.
The 4 o'clock dinner
exactly.
in Florida, right? That's why you have the silver-haired special.
Yeah.
Which I'm starting to take advantage of, so I understand what you're saying. It's actually interesting when you were saying that the adolescents, they go to sleep later. I was reading something. That's so that when the parents go to sleep, they get to do all this stuff without being in their sight, so they get to deviate from the norm.
Yeah,
right?
but the thing is, again, the data clearly shows that it's part of that, but part of it is that their body just wants to go to sleep a little bit later,
right.
And when we're trying to force them into a different habit, they just don't function better,
right. In terms of jumping back to diseases that we talked about, I was reading something, I think it's Sweden, that actually looks at sleep as being a carcinogen. So I know you had mentioned, is there a correlation between lack of sleep and different cancer processes, or not definitive?
Yeah, so I don't know if it's just a lack of sleep, but what we have definitely seen is shift work, right? So when you're constantly shifting between two shifts, right, whether that's morning and night shift, we definitely see increased risk of cancer. Right? A night shift is linked to increased cancer in basically all forms of cancer except melanoma. Right? All right? Because you're not in the sun.
Sleeping. Yeah. No, that makes sense.
Yeah.
Right?
But everything else, we see an increased rate of cancer from lung cancer to breast cancer to kidney cancers and things like that, the rates are definitely statistically significantly higher.
Which probably goes to the fact of what you were saying, the
Yeah.
importance of sleep to be able to heal the body, right?
Mm-hmm.
And to be able to go ahead and kind of, and I know one of the things that they're talking about too is sleep deprivation and Alzheimer's with the almost the brainwashing, right? The
Yeah.
lymphatic system taking out the amyloids.
Exactly, yeah.
And, being able to see how that
Yeah.
actually ties in to
Yeah,
play.
and so while we were talking about that consolidation of memory, right? So again, when you're sleep deprived, you're not consolidating, so you're gonna forget. And then two, like you said, there is a cleanup mechanism, right? When you're sleeping, your brain is trying to clean up all the junk that had built up when we were very active. Because again, as we're active, because the brain is constantly running, you're building byproducts, right? Which is junk. Right. And one of the byproducts is something called beta amyloid. All right. And so when you get healthy amount of sleep, you're starting to clear the system out. So when you get your 7-8 hours of sleep, the brain says, hey, we've cleaned everything up, right? But when you start getting 5 hours of sleep, now there's still junk that's still there that hasn't completely gone away. And so beta amyloid is a protein buildup that we see in Alzheimer's disease. All right. And so the analogy I like to give is imagine your brain is made up of millions and millions of rooms, right? And basically beta amyloid is like garbage, right? I throw a little garbage here. Now more and more garbage builds up because we're not cleaning it up during sleep. And now this room becomes useless. The next room becomes useless. Next room becomes useless. And over time, more rooms that become useless, the less function your brain is going to be able to perform, and that's where dementia comes into the picture. Right. All right. Obviously, in Alzheimer's, there's other components that play a role, but I think again, sleep plays a big component.
Right. Yeah, so obviously from that perspective, I mean, sleep there's not one system that it doesn't touch.
Yeah.
And one of the other things that we talk a lot about, we've touched on this with the inability to use the prefrontal cortex and the emotional component and the connection is lack of sleep contributes to mental health disease, anxiety, depression, things of that nature. It's interesting in your practice, in both neurology as well as your specialty in sleep. How much do you think stress plays a role in disease processes?
I think stress has been clearly shown to affect everything. All right, from musculoskeletal issues to heart issues to respiratory issues to immune system, right? And so it is a big component on how people function and why they get the disease processes that they do. All right, and so again, there's lots of data that shows that it can exacerbate your breathing problems, right? Because when you're in a state of chronic stress, you're in this fight and flight response, right? Where your body's like, okay, we're either fighting whatever enemy's coming at us or we're going to be running away, right? And when you're in that response, when you have some underlying problems like in breathing, asthma or COPD, it's going to cause exacerbations, right? We know that that flight or flight response leads to your blood pressure going up, your heart rate going up, right? So it leads to a lot of cardiovascular type disease process, increases risk of stroke, heart attack. Simple things as muscles, right? Mm-hmm. When you're in that flight or fright response, your muscles become tense. And there's literature on how it leads to chronic pain down the line, right? It can affect your gut, right? It can lead to bloating, abdominal pain. It can affect, obviously, your testosterone, right? Mm-hmm. For male patients, we've seen chronic stress decreases your sexual drive. It increases risk of erectile dysfunction. It decreases your ability to conceive, because we've seen that chronic stress has led to decreased sperm motility, right? In females, it can cause absent or irregular menstrual cycles. It can cause painful periods. It can affect your ability to conceive as well, right? And so those are big components. And then on top of that, it affects your sleep, right? It affects your ability to fall asleep. It fragments your sleep. And so kind of what we talked about, how sleep deprivation can have effects on all kinds of body. I really wanted to kind of throw out some of these statistics about
please.
Effects of chronic sleep deprivation, right? So like I said, lots and lots of studies have shown that it not only affects your health, but it affects your performance as well, right? So studies have shown that if you get less than 6 hours of sleep, it increases risk of obesity by 7.5 times. All right, compared to someone who's getting 7 or 8 hours of sleep.
Because of the hormonal changes in leptin and ghrelin and things of that
Exactly.
nature.
So insufficient sleep is associated with lower leptin levels, which is what suppresses your appetite, and increased levels of ghrelin, which stimulates appetite. And so when you're getting more ghrelin, you're gonna eat more, and that's where we see the link between obesity and sleep deprivation. Again, less than 5 hours of sleep is associated with 2.5 times the risk of diabetes. Less than 6 hours of sleep increases the risk of diabetes by 1.57 times. Less than 5 hours of sleep is associated with 45% increased risk of heart attack. All right. There's lots and lots of studies, especially it's in adolescence, that it's shown that a higher level of depressed mood, anxiety, behavioral problems causes increased use of alcohol and attempted suicide.
I think we should stop here. I'm going to go take a nap. I'm so nervous.
Yeah, and then just less than 5 hours of sleep has also been linked to just 15% increased risk of mortality.
Yeah.
Right? And so many consequences that are linked to stress affecting sleep, which can affect all these different components of your body functioning, you know.
And I think it's almost cyclical, right?
Yeah.
Because if you don't sleep, you're going to be more stressed.
Yeah.
And your ability to handle things is going to be harder.
Yep.
Now you have the inability to handle things, and just like you said, if you evoke fight and flight response, right? Your threat response. Now you can't sleep. And it becomes so cyclical that you really need to be able to kind of pull away from that. And I think that's the importance of what we talk about. That you know, when the My Focus model that we talk about. One of the things is fitness, and fitness is the foundation, and on the foundation of physical fitness lies sleep.
Yeah.
Because if you're not able to get, nothing else is going to matter in what you're going to do. It's going to just create this stressful environment and your inability to sleep. A lot of times, I mean, we know, both of us being physicians, that we look at metrics. So are you a big proponent of the wearables, the Oura Ring? I know I have that on. I've got my smartwatch on, and they keep dinging, so I can't go to sleep. But
no, so I think it's data, right? And I think some data is better than no data, but I don't want people to think that, hey, this will fix my problems, right? And so I think sometimes it's marketed that, oh, this will help you fix all your issues, and it's just not enough, all right? While more and more technology is helping us get more and more data, it's still not as good as a sleep study, right? Coming into the lab and having these different devices on you that will monitor from your breathing, your heart rate, if you're actually sleeping, how you're moving your arms and legs. And so it's not a replacement. But I think, again, it's some concrete data, right, that can help you say, hey, I'm not getting enough sleep. Or, hey, I'm having some problems. I should seek help. And so that's how I want patients to use this, not to say, oh, hey, everything's hunky-dory.
Yeah, you can't buy an Oura Ring and think your insomnia is going to go away.
Exactly. I want them to say that, hey, because of this, I'm seeing this problem, right? This device is telling me that I'm only getting 5 hours of good sleep, or I'm only getting 6 hours of good sleep. How can I make it better, right? And so I think that's where we need people to recognize that, hey, use this for helping you figure out when you need help, right?
And I always tell my clients, to those that either disruptive behavior or those that we're helping with just peak performance, I think taking the data and having an understanding of what those measurements are kind of helps you formulate your day. So if you look at your Aura data or your Fitbit or your iWatch data, and you see that you really slept bad, I think you have to be at a higher level in understanding that today may be a bad day. I may have to curb the way I approach people a little bit and be a little bit cautious. So I think from that perspective, it's important.
Yeah, I always tell my patients that, hey, everyone's going to have bad days, right? Everyone's going to have a period of insomnia, right? You're going to be under stress from work, right? There's a big project you're working on. Or, hey, something's going on at home. There was a death in the family. Or my daughter is very sick, right? And during that time, you're going to have some issues, right? You're not going to sleep very well. You're going to be anxious, or you're going to be thinking constantly about X, Y, Z. But that's where the problem typically starts, right? There's some kind of provoking factor. But then what happens is during that time period, if you start developing bad habits, that's when the provoking factor goes away, but these bad habits are going to persist on, right? And so that's where we have to be very careful and going back to, like we talked about, those sleep hygiene and do those smart things that, hey, make sure you're going to sleep consistently, right? Eat healthy, exercise regularly, avoid the late night caffeine, avoid the alcohol, and go back to your basics to kind of help resolve those issues.
Right. Switching gears a little bit, why medicine for you?
I've thought about that multiple times in my life. And I don't know if I can say there was this one thing that geared me to that, right? It wasn't like, hey, there was this doctor that I saw, right? Ever since I was little, I always thought of medicine, right? I don't know if it was that drive to just help people, right? But it wasn't like some kind of one thing that happened, but all I can think of was ever since I was a little boy in India, I've always wanted to be a doctor, you know? And so I think now I really enjoy the fact that I can help people function better, right? I can help them improve their quality of life, right? Unfortunately, in neurology, I can't cure a lot of diseases, but at least I can manage their symptoms so their quality of life is as best as they can get, you know?
I always joked because people don't know your family, but your patriarch, for lack of a better term, was Dr. Morker, who's since passed away, but he was a tremendous person. But I used to joke with him because so many of your family members were physicians. So as a chief medical officer, any place I had to fill a void. So when it was Thanksgiving, I said, who's coming over? What residencies can we pick for the different guys? So down the line, I'd be able to fill the roster. So that was interesting. But so I know we talked off camera because I've known you for a while. The neurology is kind of, it's hard because you're not able to really cure a lot of things, but you are able to help in the quality of life. Burnout. One of the things that I'm passionate about, and one of the things that I coach to. How do you deal with burnout?
I think, again, you're probably going to be able to speak to this a lot better than I can. But again, the main thing is self-reflecting and healthy habits, right? Start focusing on you, right? Because a lot of times it's because of pressures at work, working extra overtime, right? Always having that sense to do better, right? And that you're somehow not living up to the standards that you need to, right? And that drive to always just push yourself is what leads to burnout, I feel like. All right. And what we need to do is reflect, right? Self-reflect and say, hey, what's more important, right? Like you said, there's always that, we are always that drive to build wealth, and that then the wealth is what we're going to use to get ourselves better, right? And so, again, the big things are get back into good sleep habits, right? Make sure you're making that sleep a priority, right? Making sure that, hey, it's not however much time I'll sleep. It's, hey, I'm going to go to sleep at this time. Set an alarm, right? We set an alarm to wake up every morning. Set an alarm to go to sleep, right? To say, hey, I have to wake up at 6 o'clock, so I'm going to get 7 hours of sleep. So I'm going to set an alarm for 11 o'clock. No matter what I'm doing, I'm going to shut everything off and try to go to sleep, right? Or eight hours, however many you need, right? Make sure you start eating healthy, right? Lots of junk food is going to lead to other problems, and that leads to more burnout, And so eat healthier foods. Start exercising regularly. So much data that shows that it helps in this kind of process to enhance your healthy hormones, right? And feel good hormones like dopamine, and it also counters all kinds of other health problems. It can be a lot of patients use it as a way to kind of decompress, right? Where you stop thinking about everything and you're just focusing on your health and feeling better.
And as you said, helps you sleep.
Yeah, exactly. And then the other big thing that we realize is in burnout is that you start isolating yourself, right? You disconnect from your family, you disconnect from your friends. And so rebuilding those social connections are very important, right? Even if it's work friends, right? Go out with them, right? Go out for a drink. Go out for
As long as it's 2 hours before sleep.
Exactly. Go out for dinner, right? And restart connecting with family and friends, right? Because again, that can be a very helpful way, like we talked about stress, to kind of de-stress, right? And find healthy ways of countering that, because we know that when you don't find healthy ways to release your stress, it can build up. And from a neurologic standpoint, I see a lot of patients coming in with something called conversion reaction, right? It will, your brain will essentially say, hey, this is not healthy. We're going to shut down if it doesn't work like this. And so your subconscious will make you not be able to move your arm, not be able to walk. I've seen patients who come in because of this stress buildup that they're like, they can't see. We run all these tests, everything comes back normal, and then we find out that, hey, it's this stress, anxiety, depression that's built up over time, and once we treat it, everything goes back to normal. And so your brain works in very interesting ways, and I always tell my patients, we know a lot about our brain functioning, but we probably don't even know 50% of everything, And so that component is very important in trying to make sure we're addressing in a healthy manner, And so again, take a closer look at the problem at hand. Why are you in the state that you're at? And ask for help, right? I think that's very important. Ask your colleagues to say, hey, how can I relieve some of this burden, right? Ask your family to say, hey, how can they help you in feeling better or helping you de-stress, right? And so those are kind of the big things that I say to kind of counter burnout.
And I think it's funny, I think from a physician perspective, I like one thing that you said, self-reflection.
Yeah.
And one of the things that we coach to is self-awareness. And self-awareness has three components: mindfulness, being present in the moment.
Mm-hmm.
Second piece is exactly what you said, self-reflection, because I think we need to constantly take a look, where are we and what do we need to improve? And then the last one is feedback, right?
Yeah.
So the ability for someone, either feedback that you could visualize because you're listening to what people are saying about you, or feedback that you actually ask for to be able to go ahead and give back. I think from the physician community, though, I think what's very difficult is physicians don't like to show weakness. That's how we were trained.
Yes.
So the thing that you said, ask for help, I think that's the last thing that they do, because they look at it from the perspective of saying, that's going to make me look weak.
Yeah.
And that's not the way we do it. And it's really strange, because when you look in the sports world, people will go to coaches and pay up-teen amounts of money and all kinds of things to tell them, hey, listen, when you're batting, make sure you move your left foot back and bring your right elbow up. And they don't take it as negative. But I think what happens with medicine is, because we always had to be close to perfect to get what we wanted, that anytime we get feedback, it's a negative
It's a
thing to
criticism,
us,
yeah,
and
yeah.
we try to almost deflect it,
yeah,
right? And,
yeah.
and I think that's a little bit different than anybody else
Yeah,
that does stuff.
Yeah. I think one of the big thing is, again, like you said, it's rooted from our training, right? That, hey, we did it this way, now you're gonna do it this way.
Right.
You know, and so again, that was one of the things that when I was in residency and my colleagues, we recognized, hey, we don't have to do it the old way, right? The old way was, hey, you're gonna be thrown in there and you're gonna figure it out, and that's how you're gonna learn. And I think, again, some of it, yes. You know, I think, again, when I was on call 30 hours a day, when I was the only neurologist in the hospital, taking care of the whole hospital, you know, that's where you learn the best. But was that always the safest?
Right.
Was that always the best environment, right? That I had no backup or anything, right? I don't know. And we tried to change the model for our residents when we became seniors, you know? And I think, again, that's where we need to break that old-fashioned tradition that, hey, if you ask for help, it's weakness, and say, hey, no, we need to improve, right? Because down the line, it's going to lead to burnout. It's going to lead to less physicians that are available. Already there's a shortage, and it's going to just lead to poor outcomes.
Yeah,
you know?
and none of us chose medicine to say, hey, 10, 15 years in, I want to be miserable, I want to be stressed, I want to have type 2 diabetes, heart disease, being on my third wife. That was never the blueprint.
Yeah,
Nobody ever looked at that.
Exactly.
So set up those habits. Speaking of habits, one question that I have is this being a self-development podcast, a medicine podcast, touch a little bit on cars. What is the one habit, if you could isolate one habit, it's a tough question, that you think helped you be successful as to where you are today?
I think, again, if I have to just say one thing, I think it's really finding that balance, right? Finding that balance of what needs to be done and how am I gonna be able to keep that sanity, right? And I think I was lucky in that I always had family around me, right? I had my cousins. We went to the same med school. I had one of my cousins who went to the same hospital for residency, and so we lived together. And I think that really helped me because while I was working, and it was intense. But then I always had these core group of people that I could go back to and just kind of de-stress, you know? And I think that's the big thing, is maintaining those kind of connections where you have an outlet to let go.
Fantastic.
Yeah.
And if not medicine, what would you have done?
Yeah, I think about that all the time, you know. I think about flying jets. I think that would be fun. I think teaching would be something I would really enjoy. And then definitely engineering, right? I like to tinker with things. I still open up things, like I'll open up a broken iPhone just to see how things work, you know. And so I love tinkering with things. So I think those are some of the fields that...
Which kind of fits neurology with all the pathways and everything else. So I could see how you picked that. Well, Dr. Morker, Minesh, thank you so much for joining us today. I appreciate it. It was a great discussion, and look forward to talking to you again soon.
Awesome. Yeah.
Take
Thanks
care.
for having us. Thanks.